Hi everyone, in today's video, I'm going to talk about how exercise affect blood pressure, give you the great method, lower blood pressure easily. Well, you know that exercise can increase blood pressure, but the effects are typically temporary. Your blood pressure should gradually return to normal after you finish exercising. The quicker your blood pressure returns to its resting level, the healthier you probably are. According to guidelines provided by the Centers for Disease Control and Prevention, normal blood pressure is less than 120/80ths of a millimeter Hg. This includes a systolic pressure reading under 120 mm Hg, and a diastolic pressure reading under 80 mm Hg. However, diastolic blood pressure is a measure of the pressure in the blood vessels between heartbeats. It shouldn't change significantly during exercise. If it does, consult your doctor. It's difficult to say conclusively what blood pressure readings are considered healthy after exercise, as blood pressure varies from person to person. Normal levels for one person might be a sign of a problem for another person. In general, though, high blood pressure after a resting period of up to 2 hours following exercise includes any reading greater than 140/90ths of a millimeter Hg. Low blood pressure after exercise includes any reading lower than 90/60ths of a millimeter Hg. As you can see, exercise can help regulate blood pressure. If you have hypotension or are at risk for or have hypertension, the following tips can help you improve safety. In fact, exercise a little bit every day to keep your blood pressure in check. Check with a doctor or other healthcare professional if you aren't active but would like to be more active. Well, opt for moderate activities, such as walking, swimming, or cycling. Increase the length and intensity of your workout gradually. And warm up before exercising to avoid injuries. Stop your exercise activity gradually. A cool-down period is crucial for people with high blood pressure. It allows you to slowly return to your pre-exercise heart rate and blood pressure. Also check with your doctor before starting a new exercise program if you have low blood pressure. Exercise, especially exercise that involves sudden changes in posture, can trigger symptoms, including dizziness, blurred vision, and nausea. Well, that doesn't mean you shouldn't exercise if you have low blood pressure. In fact, exercise can also be beneficial in treating hypotension, as it helps improve blood circulation. If you have low blood pressure, opt for moderate activities that don't involve bending and rising quickly to an upright position. A spike or drop in blood pressure during exercise can be a sign of a medical condition. A dramatic increase in blood pressure during or after exercise could be a sign of being at risk for hypertension, having exercise hypertension. If your blood pressure rises quickly to a reading of 180/120ths of a millimeter Hg or greater, seek emergency medical attention. Unmonitored blood pressure in this range can be a sign of a heart attack or stroke. You know that significant drops in blood pressure after exercise are a risk factor for developing or having hypertension and having certain types of heart disease. While most people experience a slight drop in blood pressure following exercise, research suggests that people with hypertension experience more significant decreases in blood pressure. To learn more about how to lower your blood sugar and heal diabetes easily, click link in description below.